Hello, my name is Maria Anselmo, and I will be presenting um, a recent quality improvement initiative that was implemented at my hospital, which is Nurse Bedside Report with a handoff tool. This will be where my video link will be, my objectives, my audience will be able to the situation and background for change. So, nurse shift to shift handoff communication is now normally done outside the patient's rooms at the nurse's station. Nurse handoff is an essential component in the hospital setting. This gives the nurses and caregivers a chance to exchange critical information like code status, head to toe assessment, lines, tubes, and drains. But recently, the hospital where I've been worked for 5 years is now mandating bedside report with a required checklist that the nurses must complete, sign, and turn in before the end of their shift. This checklist includes several areas of patient assessment, like HAPI prevention, CLABSI prevention, DVT prophylaxis. Um, and the reason why we are implementing is because there has been an increase in falls, collapses, and other hospital-acquired injuries in the ICU. So they are now mandating this. Bedside report has been shown to eliminate communication gaps and enables patient and caregiver involvement. It also helps the nurses to identify safety risks and preventable injuries like pressure injuries, collapses, patient falls, etc. However, despite their efforts, leadership has tried several times for us to comply with this over the past year, and the nurses are not complying with it. So the nurse managers are now threatening formal write-ups, and I just believe that there is a need for a different approach, a different strategy to implement this change. The rationale for change and goal is to reduce preventable harm and nurse sensitive injuries. Also promotes patient safety, decreases preventable harm, and hospital costs. Also, the goal is to decrease the prevalence of HAPIs, CAUTIs, CLABSIs through provider communication. Also, identifying risk factors through nurse assessment skills, enhanced patient-centered care, and engagement. Also, it will facilitate provider communication and strengthen accountability. Poor communication has contributed to 80% of medical errors that occur during report, according to the Joint Commission. Factors that negatively affect handoff are interruptions, staff shortages, lack of staff culture, and organizational standardized procedures and inaccurate patient information. Implications of practice. So the ethical implications are to promote honesty, beneficence, and non-maleficence. The economic implications are to reduce patient hospital stays and unavoidable injuries associated with costs, lack of reimbursement from insurance companies. The social implications are a lack of provider trust and poor patient experiences when these injuries occur. So basically, when a patient is injured, it may result in a mistrust in the staff and obviously poor patient satisfaction. The legal implications are that hospitals are liable for anything and everything that happens in the hospital, including preventable disease. Political implications is that the staff has been resistant. The staff feels that there's a lack of autonomy. Also, quality metrics that are associated with reimbursement and also play a role as this kind of tells us where resources are allocated and dispersed throughout the hospital. The advanced practice registers Registered nurse's role as a change agent is to lead by example, inspire staff, and exercise transformational leadership principles. They encourage patient safety improvements using excellent communication skills and collaboration and to decrease preventable disease. They guide others to move forward towards a shared vision of minimizing harm. Internal and external stakeholders. Um, Stakeholders should be involved very early on in the change process. Stakeholders should be involved for optimal results and outcomes. They should be interacting with staff members who will be implementing the change to facilitate trust and adherence to the change. Internal stakeholders would, for this quality improvement initiative, will be nurses, nurse leaders and managers, QI department, HR department, risk management team, patients in the critical care units, and family members. External stakeholders include regulatory bodies such as regulatory bodies, professional associations such as the American Nurses Association, the Joint Commission, insurance companies for hospital reimbursements. We will be discussing Lewin's change model as a strategy for implementing this change and achieving success. Lewin's model is a three-step process that includes unfreezing, moving, and refreezing. Unfreezing involves unlearning the current practices, which is very difficult to do at times. It's harder to unlearn something than to learn something new. Preparing employees also. Stakeholder involvement is crucial. Educating staff members and establishing a shared vision for zero preventable harm should be done during this phase as well. So lots of education, lots of gaining insight. Moving would be implementing the change, and that's step two. So the change team must be present and oversee and monitor the change. The change team is present to address staff concerns, provide support and encouragement, and just be there for the staff for anything that they need. Refreezing is the last step, which includes reinforcing the desired behaviors and change. This includes continuous support and positive feedback to yield staff compliance. So again, the change team is present even after the change has been somewhat solidified and implemented across all the ICU. Also, the change team should address resistance and conduct feedback sessions to gather insights. This is an outline for initiating bedside report. So step one, assess current practice. This includes completing an evaluation of current practices and kind of gaining insight from the staff members on how current practices are hindering our ability to identify risk factors for hospital-acquired injuries. It's, like I said, very important to maintain transparency to facilitate trust. Number two is to review evidence with reliable sources to gather as much information that can be presented to the change team and presented to affected staff so that they, I'm sorry, they understand that it will result in positive outcomes, increase nurse satisfaction, and decrease hospital-acquired injuries. Number three is to create an interdisciplinary change team. We want to value multiple perspectives of the process and engage as many stakeholders that are eager and excited to implement this change. We also want to gather nursing perspective on current handoff practices and assess for gaps, inquiry on opinion of implementing bedside report and how this will affect the nurse. How will this affect the patient? So is there anything that can hinder the ability to implement bedside report? Also, unfreezing and making sense. This is where we create problem awareness and create a sense of urgency for change among staff. Number four is to design a vision so we can survey the bedside nurses on what their vision is on how handoff can assist in preventing patient harm. Number five is to design the checklist that's mandatory for them to turn in with the change team and the stakeholders, as well as the bedside nurses. Number six is to develop the plan with the change team. Number seven is to educate and prepare bedside nurses, and we need to address any resistance or facilitations that are occurring. Number eight is to conduct a pilot study. So there's three different ICUs in my at my job. So maybe we could do one pilot study on one out of three, see how it goes, make adjustments as needed over that specific time frame before we launch to number nine, which is to the implementing it to the entire ICU division. And number 10 is to evaluate the desired outcomes and whether the goal of decreasing these injuries actually was achieved. So in 2 years, did we see a decrease in falls? Did we see a decrease in pressure injuries? If this is unsuccessful again, this will have an impact on the organization in a negative way. Staff will feel discouraged. Workplace culture and environment, since we're talking about that, is decreased staff morale, mistrust in mistrust in the change team and nurse leaders, and increase in nurse burnout and turnover. Health and safety, we could potentially see no changes or an increase of injuries. Financial, this will result in increased hospital costs and lengthen patient stays. Steps to move forward are to do a root cause analysis so we can understand why these objectives were not met. Again, this could be from lack of education, lack of training, lack of surveillance and monitoring, and lack of leadership support. So we want to re-engage the stakeholders, change team, and nursing staff, clarify our goals, and we now know that practicality will play a role. Additional factors that drive organizational change will be the expanding scope of practitioners and support staff. So nurse assistants might have a change in scope, more awareness surrounding hospital-related injuries. We also have AI and other technological advances that can generate risk scores and aid in statistical data that will help with injuries. Also, expansions of value-based systems, changes in reimbursement models from insurance companies, and in aging populations. All of those factors will make an impact. The advanced practice registered nurse as a change agent is responsible for clinical leadership and interprofessional collaboration. They facilitate mutual decision making and staff accountability by using guidance and inspiration. Also, policy expansion and advocacy. Not only do they advocate for patients, but they are advocating for staff as well. Education and mentorship. We are mentoring others in health promoting strategy, sustaining change, and cultivating an environment that embraces change and continues their education. Also, transformational leadership principles is a huge role of the registered advanced practice registered nurse as they lead the healthcare team to improve their practice standards. Thank you so much for listening to my presentation.